Hi, I'm Dr. Gurung. I'm a consultant psychiatrist. Today I'm making this video on a topic called dementia. The reason why I'm making this video is quite recently I've been getting a lot of referral from a neurologist and other professionals querying whether a patient has got dementia. And what I've realized that even in the medical professionals, they don't have much concept of dementia. So I wonder it would be worse in a society or a layman person to understand dementia. So I hope um, by sharing my expertise on dementia, a lot of the people might be aware of what to look for if they suspect their family members could have dementia. So in UK, first of all, if someone has got memory problem or cognition, memory is an ability to remember the facts. Cognition is an ability to do day-to-day activities. So in UK, the first and the foremost thing that if anyone has got a suspicious of having memory and cognition, they need to go to GP. The GP needs to do extensive physical examination, which includes blood test. In blood test, they have to rule out vitamin B12 if they have got problem with the thyroid, if they have got problem with their blood sugar, that can also cause memory problem. I've seen especially in older population having low iron like ferrous can also cause problem with memory and cognition. The second common condition which I have seen in the elder population is urine and chest infection can cause a condition called delirium, confusion and memory. Once the cause is treated, the memory and the cognition tends to get better. And the third condition that we need to rule out before we reach to the diagnosis of dementia is the mental health conditions can also give an impression of problem with memory and cognition. So some of the mental health problem that can cause a memory and cognition is first is depression, when they have got lack of motivation, problem with the sleep, and they are not able to exercise their brain too much. So it also gives the impression that their memory and cognition is not strong enough. The second is stress related, not having too much of stimulation and not using the brain can also give the impression that the brain is not functioning well. So before any patient is referred to us, just to summarize, first they need to go to GP and they need to rule out the physical health conditions. Some of the physical health conditions which can cause problem with memory and cognitions are vitamin B12, ferric sulfide, problem with thyroid, problem with blood sugar, especially with female. In menopause, they have got brain fog, so this also needs to be ruled out. The second thing that we need to rule out is mental health conditions like depression, anxiety, stress can also mimic and can cause problem with memory and cognition. Now let us jump to the topic of dementia. So to understand dementia, dementia is not a single disease, but is a general term to define if someone have got cognitive ability, the cognitive impairment, that means that ability to day-to-day functions is effective to interfere with their daily life. Okay, so when we talk about dementia, the things that we look for is problem with memory, thinking and social ability. Now we also need to rule out from normal aging process. In normal aging process also we see the memory going downhill, but with dementia the decline is much faster, and the areas that we tend to see more often is memory, communication, focus and reasoning. Okay, and keep in mind dementia is a progressive condition. That means it's a one-way traffic. As the time progresses, things are going to get worse. So some of the symptoms that we see in dementia are memory loss, difficulty in planning, solving problem, um, or solving problem of familiar tasks, confusion with time and place, uh, problem in visual image, problem in finding direction. We will also notice that the problem with words, speaking, misplacing things, poor judgment, withdrawal from their work and social activities, change in the mood and personality. So these are some of the symptoms that we see. Now, coming to the types of dementia, there are different types of dementia, but I'm just basically going to discuss the five main type of dementia that we see. So the number one dementia we see is something called Alzheimer dementia, which happen in 60 to 80% of the cases. In this, the memory decline is gradual. So most of the patient that comes to me, they say that they have noticed a problem with the memory like 12 to 18 months, and down the line what they have noticed is the memory decline is gradual, and the memory decline is especially with the short-term memory, not able to retain, recall, repeating the same thing again and again, misplacing things and forgetting that where they have kept. So these are some of the symptoms that we see in Alzheimer dementia. And the family also report that the care that they have to give have increased, and family also reports care burnt down. So Alzheimer dementia is seen in 60 to 80% of the cases. Now the second common is something called vascular dementia, which happen in 10 to 20%. In this, the main thing that happen is because of something like stroke, heart attack, blood supply to the brain or oxygen doesn't go to the part of the brain, and that part of the brain dies. The decline is like step ladder. It goes boom like this, and on another episode it goes boom like this. Okay. The third common is something called Lewy body dementia, which happen in 5 to 10%. In Lewy body dementia, we see two aspects of it. One aspect is we see problem with their mobility, giving the typical features of Parkinsonism like shake, shivering, shuffling gait, mask-like face. And with the Lewy body dementia, the memory, there's a fluctuation of memory, and the decline is very fast. And people with Lewy body dementia, they also complain problem with RMA sleep. That means that when they go to sleep, it's very difficult to maintain. Most of them, they also complain of visual hallucination, seeing things which are not there. Now the fourth dementia is frontotemporal dementia. This happens especially after head injury, and there are two aspects that we see in frontotemporal dementia. There's a behavior variant, which is personality change, loss of empathy, inappropriate social behavior. We also see that there's also a progressive decline in producing word. So this is seen with frontotemporal. In frontotemporal, a family complained that there has been a drastic change in personality. Now, in terms of a treatment, we only have got treatment for Alzheimer dementia. Unfortunately, we don't have any treatment for other types of dementia. So the good news is, if people have got Alzheimer dementia and if they come in the early stage, we have got some medication which can slow down the process of dementia. The medication that we normally tried is something called cholinesterase inhibitors like doneprazole, rivastigmine. The second group that we usually offer in UK is NMDA antagonists like memantine. So they help to slow down the memory problem. The other advice which I always give to my patients having dementia is the non-pharmacological treatment. Number one, we have to establish a routine. Simple, make the task simple. We also need to work on the cognitive stimulation, like encourage them to do puzzle, music, gardening, or the things that they enjoy. Bit of physical activities needed. And if there are some problem with taking management of the day-to-day activities, we also refer to the social services so their carers needs can be assessed through them. Now in dementia, one of the interesting thing which I found is, especially the dementia, there are also behavioral and psychological disturbance that we find. For that, we need to use some medication in order to control, like antidepressant, antipsychotic, and mood stabilizer can also be used. Now the other thing which is quietly ignored in dementia is, when people have got dementia, we also need to be forthcoming to have a difficult conversation to discuss about advanced directive. Advanced directive means establish the healthcare power of attenuity of living well. So we also need to ask them, if things deteriorate, what does the patient really wants to be taken care of. We also have the options of palliative care and hospice care. Okay, so this is all to do with dementia. Now just to summarize, before we jump to dementia, there are certain conditions that need to be ruled out before dementia. I've explained what is dementia. I've explained the types of dementia. I've also explained the treatment that is needed for dementia. Thank you very much.